From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is Bon Secours Maryview Nursing Care Center is ranked as one of the best nursing homes in the U.S. by U.S. News and World Report in their 2011 Best Nursing Homes Rankings. On February 15, 2011, Bon Secours Maryview Nursing Care Center received word from the U.S. News and World Report that they were ranked among the best nursing homes in the U.S. for 2011. U.S. News' Best Nursing Homes profiles more than 15,000 facilities and ranks them by state using data and quality ratings from the federal government, and the rankings are updated quarterly. The rankings rely on information from the Centers for Medicare and Medicaid Services, the federal agency that sets and enforces quality standards for all homes enrolled in Medicare or Medicaid. Homes receive an overall rating of 1 to 5 stars from the government based on a number of stars earned in 3 other categories: health inspections, nurse staffing, and quality of care. When asked about receiving the recognition, Bon Secours Hampton Roads Extended Care Facility's CEO Patricia L. Robertson said, "We are delighted to be included in this ranking. This is an affirmation of our commitment to provide exceptional, personalized care for every person who interacts with our health system. I am proud of the Bon Secours Maryview Nursing Care Center for answering their call to serve our residents who are in need of good help." Facilities that ranked highest in Best Nursing Homes 2011 earned overall 5-star ratings. Only about 1 home in 7 met this standard. You can find the complete report online at www.usnews.com/nursinghomes. Please join us in congratulating Bon Secours Maryview Nursing Care Center for these impressive results. In other news, from time to time we talk to Bon Secours employees to try to find out exactly why they work for Bon Secours. And we asked them exactly that question. Why do you work for Bon Secours? Today, we bring you Desmond Bibby, Project Coordinator in the Quality Department at the Health System Office.
I'm Desmond Bibby, and I am the Project Coordinator for the Quality Department. Originally, I went to school to be an airline pilot and realized I really didn't like flying planes so much as a career, so I progressed to getting a degree in aviation business. My goal was to actually run an airport or an airline, eventually work my way up. Then 9/11 happened around the same time I graduated from college, and there wasn't a job for me in the aviation industry. It was on a downturn. Yeah. So I started working in retail, and I became a retail manager for a few years, and then from there I moved into warehouse management, where I was a warehouse manager for Coca-Cola, and then I worked for Pepsi. I already started going back to school, working on my master's degree. Okay. I was getting my master's degree in project management. Of course, I was job surfing, and I saw a position on the net for a project coordinator. And I just happened to know the recruiter who was recruiting for the job, so I called her up and said, "Hey, I saw this position open. Can you think you can give me an interview or at least present my resume?" She presented it. They wanted to interview me. I came in, interviewed, and the rest is history.
Why do you work for Bon Secours?
And that's a good question. And I think you might want to word it is, why do I continue working for Bon Secours?
Yeah, why do you continue to work
And
for Bon
the reason I continue working is because it actually is the mission of good help to those in need, and it's not just a slogan. It's actually it's what we do here. Mm-hmm. It's about the patient, and it's not the customer. It's the patient, and it's caring for them, and they actually do what they say. It's not just about getting a color on the dashboard. Mm-hmm. It's actually about how many patients did we help out, how many lives did we save. Mm-hmm. And I think at the end of the day, when it's broken down to somebody's mom, somebody's dad, somebody's brother, somebody's best friend, it's actually caring for that patient. It's not just somebody filling up a bed space. My vision of the mission is providing help to those that normally wouldn't have access to it.
And do we do that?
I believe so.
Yeah.
Yes, with what I've seen from my interactions with the sisters and our CNOs, our CNEs, our CMOs, all of them just believe in the mission of providing help to those that normally wouldn't have access to it, or the availability, or sometimes even the knowledge to know that they need it. I enjoy coming in. I definitely enjoy the people that I work with, and they definitely make it exciting. Every day I enjoy waking up, shaving. As tedious as it is, I hate shaving every day. But I shave every day, I get dressed, come into work, and I have a good time at work every day.
You can find out more about Bon Secours on our careers website at http://careers.bonsecours.com. Tell a friend. Finally, Connect Care is back in the news. This time, Connect Care marches on in Kentucky. Bellefonte Primary Care in Grayson, part of Our Lady of Bellefonte Hospital and the Bon Secours Kentucky Health System, was the first facility in Kentucky to go live with Connect Care. Connect Care is Bon Secours' state-of-the-art electronic medical record. On January 25, 2011, Glenn Sparks was the first patient to be treated by the Bellefonte Primary Care clinicians using Connect Care. Mr. Sparks reported being very satisfied with his experience. Mr. Sparks is a longtime patient at Bellefonte Primary Care in Grayson. According to Melissa Kreger, site manager at the Bellefonte Primary Care in Grayson, we are excited to be the first facility in Kentucky to go live on Connect Care. Our transition has been relatively smooth thus far, and that says a lot for our providers and our staff. They've been very receptive and positive about this change, which has made our move to Connect Care much easier. The other Bellefonte Primary Care facilities will switch to Connect Care this spring, and Our Lady of Bellefonte Hospital will go live on Connect Care July 31st. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.